Hey everybody, in this video I want to just give a doctor's perspective on Medicare. Patients sometimes ask us, what do we recommend and what are the differences? Full disclaimer, I'm by no means an insurance expert, so I recommend, speak to someone who has expertise in this, do your own research, but I can share with you the doctor's perspective and how it impacts our care. And there's government-run Medicare, which is called traditional Medicare or straight Medicare, and then there's Medicare replacement plans or Medicare Advantage plans, same thing. So when people have straight Medicare, traditional Medicare, this is the red, white, and blue Medicare card. Things are going to be run through the federal Medicare program. And it's from a doctor's perspective, this is actually the easiest to work with. These using straight Medicare is predictable. It's easy. There's not a whole lot of administrative overhead. We don't need to get prior authorizations in general for procedures, which cuts out a lot of extra time and work. And so traditional Medicare is, I think a lot of us prefer traditional Medicare because it's just the simplest, it's the easiest to work with. The Medicare replacement plans or Medicare Advantage is when basically the reason why people get that is because it wraps all the parts of Medicare into one plan. With straight Medicare, it doesn't cover prescriptions and some other things, and so people get supplemental insurance or they don't have anything and they just use the Medicare and pay for the other things out of pocket. The Medicare Advantage plans wrap everything into one plan, but they're run through private insurance companies, and this is where most of us don't like it so much because private insurance companies in general are a bit of a pain to work with. We usually have to check if prior authorizations needed for procedures, and many times they're not, but still checking it just requires staff effort and work. The thing I would caution you about as a patient is Medicare replacement or Medicare Advantage plans that are HMOs. So remember, with private insurance, there's PPO or HMO. PPO is a plan where if you see a doctor who's out of your network, there's out-of-network benefits. So you're still covered many times at a discounted rate. HMO plans are plans where there's no out-of-network benefits. So you really are restricted to see doctors in your network. And if you see someone who's out of your network, you have to pay for that as a cash pay patient. Most of us who run our own practices, we really rather not have our staff on the phone with insurance for hours a day. We'd rather have our staff helping us do our job well to take care of patients. So I would say that's the doctor's perspective. I can't speak for everyone, but I think a lot of docs would agree that traditional Medicare, straight Medicare is the easiest to work with. Next up would be the Medicare replacement plans with PPOs, and at least you get out-of-network benefits there. And then I think most of us would agree to caution against Medicare Advantage plans with HMO plans. I hope that helps.